Good morning, guys. Welcome to Learn Medicare Billings YouTube channel. So in this video, I want to answer a question that's been coming up in the Facebook group. What happens when a physician refuses to sign your plan of care? Typical situation, Medicare beneficiary, we're going to talk Medicare specifically for this. Medicare beneficiary wants therapy services. Maybe they've been a patient of yours before, maybe friends, family, somebody sent them to you, and they want to receive care. But you don't have a physician referral, and you do the initial evaluation because you've read CMS Chapter 15 Medicare Benefit Policy Manual down to Section 220. You understand Medicare does not require a physician referral. Your State Practice Act allows you to do the evaluation without a physician referral. So you do the eval. You develop the plan of care. You determine that you can help this individual with your services. You send that plan of care over to the primary care physician, and they refuse to sign. It's not an uncommon scenario. Typically, and in the specific post that I'm referencing, the physician said, I haven't seen this patient since March. It's October right now. I wouldn't sign that plan of care either. I would want to see this patient. I would want to rule out red flags for myself. The physician is assuming a certain amount of liability, saying, yes, these services are medically necessary, when that physician hasn't seen that patient. So what I would recommend, step number one, do your due diligence. Tell the patient to go see the doc. It's not a big deal. You would want that kind of off your conscience anyway. So first thing I would do is I'd tell the patient, go see the doc. Second thing I would do, I would reach out, if that physician, rightfully so, refuses to sign the plan of care, I'd ask the patient if they're seeing any other physicians for any other conditions, maybe another provider. Remember, the goal of Medicare is that you have, or rather the patient has, a physician or non-physician practitioner involved in this patient's care in some capacity. And so the whole purpose of having a signed certified plan of care is proving to Medicare, yes, this patient, this beneficiary is under the supervision, the direction, the observation of a physician, non-physician practitioner. If you can't prove that, it's not a covered service. It's not covered by Medicare. So I would first tell the patient to go see the doc. Second, ask the patient if there are any other physicians in their active treatment plan or in their ecosystem that they're seeing that would sign the plan of care. And then, I mean, you go back to the Medicare Benefit Policy Manual, review the guidelines. There is information in there in the event that you cannot get a plan of care signed and certified. You do your best for documenting the attempts that you've made, what you've done, why the physician won't sign the plan of care. But I think you might be biting off more than you can chew if you want to continue to pursue that direction. So, guys, that's the best info I have available. As always, if this stuff doesn't work, you go up to the next level, you go to the expertise of Nancy Beckley, you talk to Rick Gawanda, you talk to the individuals that have been on the other side of the table, and you see what they say, because they have the depth of knowledge and experience that we as clinicians just don't have. All right, guys, I hope this was helpful. Let me know, post in the YouTube comments what your thoughts are, what your questions are. Like this video, subscribe to the channel. We're about 2 weeks away from monetizing this channel. That's going to be a huge step in helping me produce more content for you guys. So do your best. I appreciate the support. I'll catch you on the next video.